Noma just has two definitions. One, a disease that destroys the face, and two, a disease that is an exclusive preserve of the poor. It means that if there could be improvement, general improvement in standard of living, Noma will just disappear.
We are confronted with a condition that not only affects the physical health of these innocent young people, but also their emotional well-being and their ability to live fulfilling lives.
Epidemiologically, Noma is a bacterial disease known to affect vulnerable populations living in poverty-ridden, remote areas of the country, which do not have the necessary amenities of life, plagued with conditions that lower the victim's immunity, leading to severe morbidity and mortality in these populations.
Ladies and gentlemen, the incidence of Noma is increasing.
It is important to mention that Nigeria, in collaboration with other African countries as well as partners, requested the World Health Organization to include Noma into the neglected tropical diseases list. This move will further spotlight Noma so as to receive the required attention it deserves.
We believe that Noma is underreported in the country, and to actually eradicate Noma, the NDA, Nigerian Dental Association, advocates for implementation of the National Oral Health Policy. And this policy will entail even taking oral health and integrating oral health to the primary health care centers.
This is a very special Noma Day because we don't only have a conference and the Noma Day, but we are opening and commissioning Noma Centre in Nigeria, here in Abuja.
This Noma Centre, executed by Noma Aid Nigeria Initiative with support from Hilfaction Noma EV, is being commissioned today by Professor Muhammad Ali Pate, the Honorable Coordinating Minister for Health and Social Welfare, Federal Republic of Nigeria, this 22nd day of November 2023. I will also cut this tape to the glory of God, to the glory of mankind, and to the eradication of Noma in Nigeria and the entire African continent. Thank you.
The flags of Austria, Germany, and Nigeria that will fly at the entrance of the center symbolize this coming together of people from 3 different nations to help those burdened by Noma.
It's a hospital and a children's home where the children who are treated here are staying for a long time. And so what I was thinking about, if you stay here, it shouldn't have the appearance of a hospital only, but it should also be a place where you can create memories.
I want to congratulate and make an acknowledgement to Mrs. Winklerstumpf, and who is the founder and president. As I understand, she will be celebrating 30 years of Nomad.
The establishment of the Noma Centre Abuja was funded entirely by private donations of individuals in Germany and Austria.
Please allow me to single out the late Mrs. Josephine Resner of Regensburg, Germany. In her will, she bequeathed 77,000 euros, that is about over 66 million naira, to the treatment of Noma children in the center. We have used this money to equip one of the operating theaters, and we name it after her.
We do hope all of us here today as stakeholders will ensure that the center is appropriately put to good use. As it were, Noma is a countrywide, nationwide disease that is seen in all parts of the country. So the logistics should be preempted. The logistics of bringing patients from northern parts of the country, Yobe, Maiduguri, Zamfara, I think we should start looking into this if we really want to make it a functional setup.
In a few days' time, Noma patients will start arriving here to prepare them for surgery in January. We look forward to working with you and your staff at the hospital to ensure that these buildings will become a center of excellence for the treatment of Noma as an integral part of one of Nigeria's finest health provider. Dear colleagues, thank you for going beyond the call of duty over the past years to bring us to this point today.